Hello students, today I will show an important operative finding in a common surgical procedure that is inguinal hernia surgery, that is in open surgery, open inguinal hernioplasty, a finding which we commonly come across. So what is the condition during this surgery? What is this condition which you come across or commonly see? So this is spermatic cord lipoma, lipoma of the spermatic cord. Now we will go through the few descriptions of this condition, then you will have the idea what exactly it meant, how it differs from the traditional true lipoma as such. So it originates from prepubertal fatty tissue within the internal spermatic fascia. That point is important, in proximity to the arteries, veins and lymphatics, nerves and different duct within the spermatic cord. So it occurs within the spermatic cord, and actually what is it? It is often pedunculated and always in continuity with the prepubertal fat through the deep ring. So it continues inside in continuity with the prepubertal fat. This is what, see, it continues like this. So that is the point which you have to remember. So it is in relation, in continuity with the prepubertal fat. That is how it differs from the true lipoma as such. It is very common entity which we find during open inguinal hernia surgery as such. Even laparoscopically also, when you do, you will be able to see this one. It is common on-table finding in inguinal hernia surgery, seen mainly in indirect hernia as such. So when found on table, it should be excised. So there is a debate, it's very clear, it should be excised, so there is no confusion. So European Hernia Society classifies this one as a part of inguinal hernia less than 1.5 centimeter, and in females when present it is called as round ligament lipoma. Same, spermatic cord lipoma, round ligament lipoma, or lipoma of the spermatic cord, lipoma of the round ligament in females as such. So it differs from true lipoma. This is the point I want to stress. True lipoma will not continue above through preperitoneum. This is the point which you have to remember always. So it won't continue, whereas lipoma of the spermatic cord will continue above through the prepubertal fat as such. So preoperatively it can be identified clinically as a bulge, but identified well through ultrasound and MRI imaging. So it can be identified by ultrasound or MRI preoperatively. During imaging, either ultrasound, you have to ask the patient to cough, then you will be able to see properly. High definition imaging they will do now, soundologist, they will be able to identify. Even MRI imaging will be able to identify. Dynamic MRI imaging definitely will be able to identify this lipoma of the cord as such. So that should be excised, and it differs from the true lipoma. It extends across the prepubertal fat proximally, and it is a common finding which you come across in indirect inguinal hernia. That's the point which you have to remember. So for clinical details about these conditions, please read my SRB's clinical methods in surgery, SRB's manual of surgery and operative surgery, and you can always go through detailed video lectures are there mine. You can always subscribe and go through that. So students, I hope this small operative finding, lipoma spermatic cord, you understood well, you understood the differences, and hope you understood. Thank you very much.